On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is Stephanie DeRosa Hillman, manager of Social Network, Southern and Ocean County Interfaith Advocacy and Leadership in the state of New Jersey. I met Stephanie at the NPN conference where she and her colleague presented on bridging the gap with faith-based community leaders. Stephanie's work is a practical application of cultural competency that engages diverse cultural and geographic segments to discourage substance use across the lifespan and address social determinants of health. Hello, Stephanie, and welcome to the Prevention Perk.
Hello, Steve. Thank you for having me.
Well, this is great. We were chatting before we pressed record, and I feel like we could unpack just that final sentence there about the cultural competency, diverse cultural and geographic segments, and addressing substance use across the lifespan. I'm fascinated to learn more about how you're doing that, especially through a faith-based lens. But before we unpack all of that, can you tell us a little bit about your path to prevention? How is it that you fell into this line of work?
Sure. So I've been in the behavioral health and substance use field for over 10 years. I'm actually a licensed professional counselor. So I came from the treatment sector, doing some individual therapy, group therapy, kind of across the continuum. I came to RWJ Barnabas Health, the Institute for Prevention and Recovery, almost 6 years ago now. Really on a path to improving access to youth treatment services when I started with them. Just to provide a little context, RWJ Barnabas Health is the largest hospital system in New Jersey. The Institute for Prevention and Recovery, or as we call it, IFPR, is the public health engine of the RWJ system. We serve as the bridge between clinical and community settings. So just to kind of give that piece of background. I came over on more of a clinical grant at that time when I came here. As I said, working to really kind of improve access to youth treatment services, and did some collaborative work with our prevention coalition that's also housed within the agency. From there, I actually moved into another position with IFPR, working on pain management and increasing access to non-opioid choices. With that, I teamed up with the manager of the Prevention Coalition on a CADCA grant. So that's really where I started doing some prevention work, and that grant is what brought me over to the prevention field. At that time, we applied for the funding that we now have for the social network. And when we were awarded that funding, I hopped over to the prevention side of things. It really gave me an opportunity to kind of go back to what brought me to the profession in the first place, which was, helping others and being out in the community.
Well, that's an interesting path to this point that you are now. How do you like the fit as far as doing the prevention work and the scope that you're in right now?
I'm loving it. This is, in my almost 6 years here, I've worked across different projects. This is definitely by far my favorite project so far. It's really brought me back to just those community roots and really, helping others.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Did you know that SAMHSA has actively engaged and supported faith-based and community organizations involved in substance use and mental health services since 1992? To learn more, visit samhsa.gov/faith-based initiatives. Well, I really was impressed by the presentation that you and your colleague had at the NPN conference. For many reasons, but that you were able to not only engage the faith-based sector in a community in a prevention initiative, but you have an entire network that's set up across a broad swath of the entire state of New Jersey. Is that correct?
So not the entire state. So I work specifically in one county. I work in Ocean County. And really kind of how this came about. As I mentioned, the DART Prevention Coalition is one of the regional coalitions. So they're the regional coalition in Ocean County. And through a lot of the work that we had done with them, as well as other previous work I had done, we really identified with community partners, there's this invisible line between the northern part of our county and the southern part of our county, with most of our resources located in the north. And consistent barriers to accessing those resources. So what we just talking with others and, where was the community really turning to if they couldn't access those resources, we found that our community relied heavily on our faith sector. So they were turning to them in their time of need. So that's really where the concept for this grant came from, was to, really collaborate with that faith sector.
So you essentially reached out to them. That this was not something that they were maybe even aware of that was in existence. It was something that you had identified through assessment and came to realize that the faith sector was really something that the community could draw some strength from when it came to prevention. How did you broach that conversation? How did you begin to have that network develop?
So we had a faith leader, a pastor who was involved with our regional coalition, who we had a great partnership with, approached him with the idea of, what we really wanted to do. He thought that was a great idea. So he, kind of got on board with us and helped us to, to really expand upon that concept. And then that's when we went for the funding.
So you had one coalition member, someone that was, your champion, so to speak.
Yes.
What were some of the initial challenges that you had with bringing into the fold other faith leaders?
So the faith sector has always been a sector that was a bit difficult to engage. And we hear that across the board from other community partners, from other communities. Even when we go to conferences, the faith sector seems to be difficult. I took the approach a couple different ways. So one thing that I found that was interesting was the disconnect between the faith sector and the community, which we were aware of, but also what kind of took me by surprise was actually the disconnect within the faith community itself. So I knew that, there was the initial challenge of connecting to the faith community from, a different standpoint, but I didn't realize how disconnected they were from one another. So what we had found was, they generally would have a individual, a community member come to them in time of crisis, and with the limited resources they had personally, they would try and help that individual to the best of their ability, not really realizing that maybe the congregation down the road had a food pantry, or maybe another one has, as a clothing store for individuals. So we kind of, we looked at that. That was definitely a challenge. We addressed that challenge by actually kind of coming up with some innovative systems for distributing resources. So we went out and collected the information on what resources each of those congregations had, and then created almost a faith-based resource directory. From there, we then connected them back to, we looked at the gaps that were there and the needed resources, and connected that back to some of the community partners that we had that had those resources.
Well, that's really interesting, because just as you're unpacking that, a couple of things that I hear. One, you've brought two brand new principles to the faith-based sector. One is the idea of collaboration. To me, that really seems like what's overlooked in a lot of communities is they have their own silo in which they, serve their congregations, but to collaborate with other churches. So you've brought that principle that comes from the prevention background. But the other thing is what was it like to start unpacking the idea of prevention? Because I've done this for a number of years, and I've tried to explain it to my friends and family, and they kind of look at me like, okay, so now what is it that you do? How are you able to bring an awareness to what is prevention, and how a faith-based or a church can really be beneficial in building that out, or creating a faith-based, prevention initiative?
So that took a little creativity. So I went and met with them individually, and told them that I wanted to learn from them and trying to build that trust. And then what I did was try and change our language to fit some of their language. So many of the congregations have what they call their missions. Some are substance use, some are mental health, some are housing, some are food insecurity. So I utilized those, and then really tried to show them how were already doing prevention work through those mission work that they were already doing, and how it could go hand in hand, and how that with collaboration and building that trust and allowing others in, that we could expand upon the efforts that they were already doing. I really took the approach of wanting to support the work that they were already doing, not come in and change that work.
So is this like one big coalition, or is each community have its own coalition and then some faith-based members belong to that? Because when you come together to someone from each one of these churches, are they represented collectively?
So I have what I would consider like my general like coalition list. And that's everybody and anybody, within the faith sector, faith-based organizations that want to be involved. We've also, with building the partnership. So I looked at how I could build the trust. So we have some teachers who were, very involved in our larger coalition, who we had trusted relationships with. They're actually the youth group leaders in their local congregations. So I leveraged those relationships, had them introduce me to their lead pastors to start building that. We have a very good relationship with our prosecutor and our prosecutor's office, who also have a chaplains program. So we utilize that partnership. Some of the faith leaders that are involved in our coalition are now chaplains for them, and vice versa. Some of the other partnerships that we really, same with our, the police stations. We have a very good relationship with a lot of our local police departments. A lot of them are chaplains. We have chaplains within the hospital system. So really kind of pulling on those relationships to then build that trust out, to bring more people around the table. And what I did from that is we have that general coalition list. So all of our information goes to them, any invitations for meetings or events or anything that we're having. And then I have an executive steering committee. So these are really the champions within the faith sector that have really, gotten very heavily involved with this, and have trying to think of the word. They're just very passionate about the prevention work, and have a lot of buy-in to it. And those have become really kind of our steering committee members.
So there really is some true collaboration, because you started out by kind of saying they existed in their own little silos. They were serving the mission within their own congregation. Now they've branched out to serving the community, and they really sound like they're working together without those barriers or those walls. It's kind of like they've figured out that working together is a smarter practice.
It's taken some time, and not all will come around the table. Sometimes it's just working individually with them rather than bringing them to the table. But I work within the realms that I can.
Now, how many congregations or churches do you have involved in your coalition work?
So I would say at the champion level, there's probably 4 or 5 of them. And then it really kind of branches out from there. And each of them engage in their own ways. So we do a lot of trainings and resource fairs. So sometimes it's they attend those. Others have us come in and do some work for them, whether, we bring in different Narcan trainings or health fair supplies, things of that nature. So it really kind of, there's, in the southern end alone, I want to say there was close to 50 congregations that we've kind of outreached, and, some are smaller, some are larger. Unfortunately, COVID definitely impacted a lot as well. We started this project in 2020, so we started it at the height of it, and COVID really impacted the faith sector a lot. Some of our congregations that are all along our water line had closed and haven't reopened. A lot were working like at diminished capacity, so they didn't have the staffing there. You know, the hours weren't there. They were working remotely. So it's definitely been a project in and of itself just to get that engagement piece. So I take their level of engagement and you know, go from there.
Well, that's like it is with practically any coalition. You have a handful of people that are champions, and then you do your best to get the support you need to execute whatever projects you're working on. One of the things that I read about you in the introduction is that you work together to discourage substance use across the lifespan, and not always, but the majority of the time, the target audience is adolescents, and there are very valid reasons why that is. What's the reception in the church to, because I could imagine them saying, well, yeah, this would be great to make sure our kids are safeguarded, but you're talking about really scratching the surface on all ages in the congregation. Has that been well received? Has that been understood, the need for that?
So in our area, we have a lot of grandparents raising their grandchildren. So we see that a lot. And I think that's, where some of that idea of, addressing it across the lifespan comes in. The way that we're doing that is looking to, as I said, really identify like service gaps and increase access to those resources, addressing the social determinant health needs. So food insecurity, access to care, housing, which are all compounding variables of substance use. So if the parent or caregiver is, experiencing those, they're, then, possibly engaging in substance use, which then, impacts our future generations, that impacts our youth and, their substance use. So by addressing the social determinant health of needs and getting them the access that they need to their basic needs, we're then impacting the future generations with substance use.
Now, are you able to bring in some evidence-based programs into this project, or is a lot of this just things that you're developing exclusively within the faith-based realm?
So we've brought in mental health first aid, which is an evidence-based program through SAMHSA. And it was, speaking with the faith leaders and looking at the data, we felt that really addressed a lot of the concerns that the community and the faith leaders had. So youth mental health teaches somebody, it's a non-clinical training that teaches somebody how to react in a time of a mental health or substance use crisis. And part of that training as well is training in addressing if somebody is suicidal, and then connecting those individuals to the resources that they need in the community.
So what are some of the things that you would consider, so you started this during COVID, and that changes everything for everyone. It's really hard to even say that's what's our baseline, because it just threw everything into chaos, so to speak. But what are some of the things that you would count as your successes so far, with this project?
So I would say some of our successes really came out of our challenges. So as you said, we started this during COVID. So data collection was a bit impacted at that point. Our youth weren't in schools, community members, weren't really engaging. So a lot of our data collection was impacted, and we got a little creative with it. So I worked with our internal data team, and we found ways to really collect that data through focus groups and the key informant interviews, and building data collection opportunities into the mental health first aid training to really, identify those gaps and barriers. I think some of our other successes was utilizing those strategic partnerships. So the partnerships that we already had to then go back and build the trust within the faith sector. And I know we had talked about, how hard sometimes it is with the faith sector, but we've learned sometimes approaching the youth pastors is a little easier. They tend to be younger and a little more open-minded to engaging with outside community resources. And then also the youth group leaders, because many of times those youth group leaders are also leaders in other capacities in our community, whether they're police officers or school teachers. I think the strategic partnerships were definitely a success for ours. As well as the systems that we created for distributing resources. So during COVID, obviously nobody was in person. There wasn't really any of those health fairs, happening that, was once that environmental strategy. So we developed a monthly newsletter that goes out, and this goes out to, everybody across the faith sector, and it highlights all the different community resources. So if there's a new resource that's added in there and highlighted, otherwise, there's a sector in there with just quick links to a lot of the community resources that they need. There's grant opportunities, because that was something that the faith sector identified they were interested in and didn't know about. So we put in trainings on how to apply for grants or what grants are available. We include updates from all of our key partners. So any of the congregations or the faith-based organizations that maybe have events coming up or providing a new service, we always include those. So I always follow up with everybody previous to sending out the newsletter. They send me anything that they might want included or highlighted, and that goes in there. Any trainings, any events, all of that goes into this monthly newsletter. So that goes out and gets shared across the sector.
So you're doing a lot. As you were talking about that, I was thinking, so by title, you're the manager of the social network. Do you have other support staff that are helping with this initiative, or are you able to get some of the volunteer initiative from the coalition members themselves to help with newsletter and that kind of stuff? How do you hold all that together and keep it moving forward?
So I do. So I have Sarah Comey, who you also met. She presented with me at NPN. So she's a prevention specialist with our agency. So she works directly with me on the social network. And then our steering committee, really kind of our champions are a big help in this too. So they're always bringing others to the table. We actually, the pastor that I had mentioned earlier, we had him trained as a trainer in the mental health first aid. So he provides the trainings with us and lends a faith-based lens to that training. But that also goes to the sustainability piece of our coalition as well. Because, in the end, if we're not there, we have our key members that can continue on with this.
Right. Well, that's good, because that's one of the things you try to start from the very beginning when you get into a project like this is, I may be around forever, or I may be around for a short period of time. We need to get you up to speed so that you can sustain the momentum with whatever the future brings, which brings me to my next question is, what are the plans for the future? Where do you see yourselves going in the next year or two?
So we found with the mental health first aid, that training in particular, since it addressed a lot of the needs of the faith sector and the community, that actually brought a lot more of them to the table. So it opened that conversation. And we afterwards, we sent out kind of like a poll, like we followed up with everybody, asking them what other trainings were they interested in, were there other topics that they would really like to hear, and we came back with like the top 5 of those. So we launched a lunch and learn series. So we had moved it from a general coalition meeting on a monthly basis to doing a steering committee meeting with just our key champions every other month. And now, in place of the regular coalition meetings, we do a lunch and learn session. So some of the topics that we've launched with that was homelessness and housing resources. So we brought in one of our very key partners who does a lot of prevention, homelessness prevention and sheltering. So we brought them in to speak about their services and the different resources. We did Nurtured Heart Approach, which is another evidence-based program, which really goes into highlighting the positives in a youth's life and utilizing it that way. So we did a training on that. We did a training on the opioid crisis. So we had our health department come in who provided a training on the substance use trends specific to our community. And then her nurse did a Narcan training for us. So anybody that was in that participated was then able to receive a Narcan kit to go back with, which a lot of our congregations had expressed interest in. And then from there, we actually brought the health department into a few of the congregations to do the training again for their parishioners. Some of them have NA and AA meetings there, so they were invited. So anybody that really wanted access to that. We actually just did another lunch and learn session yesterday where we had the National Guard come in. So we have a really good relationship with them. It's their counter drug task force. So one of the sergeants is a master resiliency trainer. So she came in yesterday and did a youth resiliency training for some of our youth pastors, which was amazing. So we're going to continue with that. And since these have been successful, the next piece of the puzzle is we are now certified as trauma-informed trainers. So we're bringing a trauma-informed and resiliency training to them as the next step.
You're listening to Prevention Perk. The 2023-2026 SAMHSA Strategic Plan presents a new person-centered mission and vision, highlighting key guiding principles and presenting new priorities, goals, and objectives. To achieve its mission, SAMHSA has identified 5 priorities, including strengthening the workforce to better meet the behavioral health needs of individuals, communities, and service providers. To view the strategic plan, visit samhsa.gov/about-us/strategic plan. There's also a link in the show notes. So when you talk about all these different convenings that you're having, the lunch and learns and the various trainings, you're aligned with several different denominations. Have you found a way to have a neutral convening space? And how did you come across that process?
So we have, and we move the meeting space around. So we have pretty good relationships with a lot of different, community agencies, whether it's the libraries, the local police departments, the fire departments, some of the county buildings. So I'm able to move these trainings and meetings around, and we do it sometimes we do host them at different congregations. It just depends. But yeah, sometimes I utilize a neutral space, just so that, everybody feels more comfortable and welcome.
Yeah. Well, I think it's great what you have been able to accomplish. And I'm hoping that if someone in the audience that's listening that's thought about this or has struggled with trying to bring the faith-based sector into their coalition initiatives, that they will be able to glean some support from this and some ideas, because it really is, to me, it's kind of unprecedented. I've heard several different presentations on, faith-based sectors in your coalition work and how to get them engaged, but you really demonstrated how you put it into action, not only with, in a small community, but you're covering a very large, not only geographical area, but you're covering a very large population area. We talked offline. I mean, I've worked in some communities where I live, with a population of like 792 people, which is, it's a small place compared to you're somewhere in the 1 million population range in New Jersey, right?
Yeah.
Yeah. Well, that's really fantastic what you've been able to do. I will put contact information in the show notes where people can get resources that you recommend, or if you're open to connecting with the audience to share your experience with them. I am curious, is there something we haven't talked about that you want to make sure the audience knows before we get away? Or is there a charge that you have for them, something you'd like for them to do?
I would just say, I guess I've been in the prevention field about 3 years, specific to prevention, and kind of came in from a behavioral health perspective. But like many other fields, I would say I feel the scope of the prevention work is changing and really expanding. And I would say to just approach it with, openness to new ideas and new partnerships, and, taking that approach of, wanting to learn and, to best support our community.
Yeah, keeping an open mind is the hardest part in this process sometimes. Well, appreciate you taking the time out to be a guest on the Prevention Perk. It's been a great conversation.
Thank you so much for having me.
My guest on this episode has been Stephanie DeRosa Hillman. Thank you for being a guest, and thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.